I wanted to tell you about a little interesting situation that happened to our mother. And this kind of thing, I think, is a little on the rare side, but not unusual to have this problem, which is a hiatal hernia. But the unusual part is when that hiatal hernia has a little opening, but when the opening gets really big, people don't realize that some of the stomach can bulge out, okay, or through it. But I want to tell you about a situation where it was worse than that. My my mother, my sister, and I, and some other people were traveling across the mountain in the winter for a Christmas time Nutcracker ballet that our niece was doing. And she was in it, and this was her last year of performing because she was going off to college. So we all were heading over there, and my mother had driven with somebody else, and apparently during that drive she wasn't feeling so well, just kind of, nauseous off and on, that kind of thing. And let me get right to the point. After the performance of the ballet, we get back to our hotel rooms. But when I called to check on my mom because she wasn't feeling well, again, my mom has dementia, she has Alzheimer's, and she cannot articulate this is what hurts, or stomach is what hurts, or I feel nauseous. She just says things like, I'm just uncomfortable, I'm just uncomfortable, I don't know, I'm just uncomfortable. A lot of people have trouble saying where in their body it hurts and what it feels like, just like it's difficult for some people to put a rating on pain. She started to have some vomiting. We go and pick her up late that night, bring her to the ER. From the ER, they're working her up for cardiac because she continues to sort of point to this area. But that wasn't the problem at all. But the workup continued for cardiac. She was ruled out for cardiac problem. And I said to the ER doc, well, what about the abdomen? Can we move on down? Because she can't say where things are really bothering her. So he had her go get an abdominal CT. He came back and he got my sister and I, now it's probably 2 a.m. or so, and he says, come here, I want to show you what I think is wrong. And he showed us that the stomach had moved and was now lodged behind the heart. Have any of you heard of that? Crazy what our bodies can do. Then he said, now it's an emergency. I need to airlift or medevac your mom back across the mountains quickly because she could lose her stomach because of the infarction or the lack of circulation, oxygen, and so forth going to the stomach. So they put an NG tube down, and that's a nasogastric tube that's supposed to go into the stomach, and it's hooked to wall suction behind the bed. Maybe some of you have seen that before. It's in the same areas where oxygen is. So they hook her up to that, but I noticed that nothing is coming out. Nothing is getting pulled out of the tube that's supposedly in her stomach. In the meantime, now they've ordered this flight. She gets in an ambulance. I go with her. We go from the ambulance to the small airfield because we're in the middle of the state, tiny airfield. And they get her all settled in. We continue to not have any progress with this tube that's down in her stomach. Nothing is coming out at all. We finally land in another little airport, then another ambulance. Now the sun's coming up, and I want to show you pictures of the sun coming up, and we're going right past Mount Rainier. I felt like I could touch it. We were so close. finally get into Seattle, where we've got some amazing medical centers. So there's Harborview Medical Center and there's University of Washington. She was supposed to go to one and then got sent to the other. So we finally get in the morning hours to the University of Washington. But the NG tube continues to not work. So this is a really critical problem. So things are not getting suctioned out. She's still having some problems with a risk to losing her stomach altogether. The cardiothoracic surgeon comes in and she says, let's do chest x-ray. Nope, it's not in the right place. It's not even in her stomach at all. Like, no shit, Sherlock, I've been saying that. And when I told the resident this, the resident said to me, we don't measure what's coming out hour by hour. We look at it every 24 hours. So it's fine. Said it's not fine. Something should be coming out. Something should be pulling out of her stomach with the suction. I don't think it's in the right place. So finally the cardiothoracic surgeon came in. We got that. She tried 2 more times to get the NG tube in, and I would say that that was probably the most horrible thing. So you're trying to tell somebody with Alzheimer's what's wrong with them and why we're doing this kind of torturous procedure on them, gagging and please mom swallow the water now, and the surgeon's trying to push it through herself. It doesn't work. So she gets a bucket, you know, the kind of bucket that we fill with warm water when we do bed baths, and she filled it up with ice and some water and put a bigger tube and stiffer tube in there and froze it the best she could. So the idea is to take this frozen tube down, really give it a good push so it will go up and around and find its way into the stomach. A couple more attempts and it worked. Another x-ray to verify it's in the right place, and it was in the right place. The cardiothoracic surgeon turns it over to the GI surgeon. So now there's a new team, and now I don't know, 30 hours I lost count at that point, and with the hours. And so the GI team comes in and says, we're going to go do surgery. We're going to do something called a fundoplication. I was familiar with that. I didn't know about the different types. I just was used to the kind for pediatrics, but they said we're doing one called a pronounced toupee. It's pronounced toupee, like the hair. It's spelled different. And that's where they're going to put the stomach in the correct place, get it back where it should be. Then they're going to take the upper part of the stomach and they're going to wrap it around the esophagus, but not all the way around, and hope that that works. So again, all my mom can say is, why am I here? How did I get here? And kept perceiving her pain to be just 10 over 10. Even when we would touch her feet, because she'd say her feet hurt, we'd lift the blankets and she'd scream out in pain. We touch the IV and she'd scream out in pain. The blood pressure cuff. So you can imagine what it was like in the recovery room. It got so bad with her feelings of pain, even though she was on the maximum dose of all pain medication they could give her. But a lot of this is just the way her mind is working, that her discomfort means 10 over 10 pain, and that's all she knows. So then the pain team came and they were setting up a dilaudid pump, a PCA pump. And we had a conversation, and we thought we'd try some other things before we do that, because if you read about putting somebody who's in their 80s through general surgery, a pretty significant surgical event, and then putting them on a lot of narcotics, and you're just adding to more of the confusion. So we got her discomfort and pain under control. But this is the problem when you release somebody from the hospital too soon. She still wasn't able to eat or drink. She would take a few sips. She refused Boost or Boost Clear, Boost Breeze. She didn't like Ensure. The dietitian came and poured her several flavors, and she said, I guess the chocolate. And then on our way, we went home with a follow-up with a dietitian closer to home and a follow-up with the GI doctor. But then within 24 hours, fever set in. She became lethargic. I go back to a different clinic, and she gets a CT of the abdomen, and they find that she has an abscess. So I want to take her right back up to University of Washington, but that doctor said, and it's Christmas time, I think now we're at December 22nd or so, but the doctor said, no, you don't get in traffic and don't put her in the car, go straight to the closest ER. We go straight to the closest ER, where we got a bed in the hallway, as many of you know how that is, after being in the waiting room with possible sepsis, 104 fever now, climbing, abdominal pain, just had surgery. We were in the waiting room for a long time. We finally get a bed in the hallway and one exam, and I said, can we transfer to University of Washington? Yes, we'll arrange for that. So some more labs, got her into an exam room or a treatment room there in the ER. And about 4 a.m., the ambulance came and got her back up to University of Washington with this high fever and what's going on? Get up to the hospital, and my mom was so sick. Now she's not talking, and her white count is still high. She's not responding to these antibiotics. They're switching her to other antibiotics, possibly going back in for surgery, but she didn't have to have that. She slowly, thank God for big pharma, right? Thank God for big pharma. Here we are. Saved her life. Antibiotics, different kinds. She slowly got better, and she got some physical therapy to get a little bit stronger. And then I talked to her surgeon and said, tomorrow's Saturday, I don't want her to go home. I think it would be too soon. She's still not drinking. We're going to be back with another problem. He said, I agree with you. Let's keep her here another day or two and just see how she does when we introduce food and some more liquids. See how she does. So we got to stay. I believe it was 2 more days. Then she was discharged back with me again. And we tried to have Christmas. I'm grateful that she survived this. I'm grateful for the surgeons. I'm grateful for the pharmacists and chemists and PhD smart people who know how to deal with something like this. Just grateful that she survived. The medevac flight was calm. It wasn't loud. It was smooth. The pilot, was introduced himself, talked with me. The two medevac flight nurses were just fantastic. My mom was in such good hands. They treated her with such kindness. They had everything under control. I felt completely comfortable at University of Washington. I was grateful for Harborview being the first choice that they couldn't take her, so we'd get over to UW. But ambulance, everybody treated us really well. I'm not saying it's always a perfect smooth road, but my mom would have died without all of these things in place. I hope this was interesting. Thank you for watching.